McDonald. Welcome to week 2 of episode 4 on fertility. We'll be covering the signs and symptoms. So let's look at some causes of infertility. First of all, we have sperm quality and quantity. You need a good amount of quality eggs for your fertility.
We need to check any hormonal imbalances, such as that involving prolactin, thyroid and adrenal hormones. And this is where you may see the low progesterone coming in that we spoke about in episode 2 and also briefly in episode 1. A blockage of one or both of the fallopian tubes, and this could be due to things such as chlamydia, pelvic adhesions, and this may be caused through surgery, and a non-tubal infection such as appendicitis and inflammatory bowel disease.
Another cause of infertility are endocrine disruptors. Now, these are often found in Tupperware, kitchen and personal care products. These are chemicals that will interfere with the body's endocrine system and produce adverse developmental, reproductive, neurological and immune effects in humans. Now, on the ingredient list, these are products, these are called phthalates and parabens, bisphenol A, the list goes on. Research from the National Institute of Environmental Health Sciences shows that endocrine disruptors may pose the greatest risk during prenatal and early postnatal development when organ and neural systems are forming.
Other things affecting infertility are things such as factor V Leiden, a form of thrombophilia, which is an inherited gene mutation that causes a blood clotting disorder. These clots may block important blood vessels throughout the body and can be associated with a slightly increased risk of miscarriage. During pregnancy, it may also increase the risk of preeclampsia, slow fetal growth, and early separation from the placenta to the uterine wall. We then also have antiphospholipid syndrome. This is an autoimmune disorder that makes antibodies that attack the phospholipids, which is in every part of our cell membrane. This attack causes cell damage, which in turn causes blood clots to form around our arteries and veins. So in relation to pregnancy complications, it could lead to premature birth, miscarriage, or possible stillbirth.
Yeah. Then we need to look at the immune system. Sometimes our immune system can produce antibodies such as cardiolipin antibodies, anti-nuclear antibodies, or natural killer cells that actually make it harder for us to fall pregnant and maintain that pregnancy. We've also got poor gut health, so that means you're not absorbing the nutrients found in your food. Vitamin D is a great example of that, which is really so essential for reproductive health.
And we actually spoke about that in episode 3, the importance of gut health. Now, weight is significantly important. It's important not to be overweight or obese or severely underweight as well. So getting it to a healthy BMI is crucial for a healthy pregnancy.
Yeah, there's great research around if you're carrying weight and how that adversely affects your fertility, as well as being underweight, which can change your ability to ovulate. So being in a good healthy weight is fundamental.
PCOS, or polycystic ovarian syndrome, is an endocrine disorder characterised by irregular periods, not always ovulating, and high levels of male hormones. Infertility affects around 40% of women with PCOS, and it's clinically seen as a leading cause of female infertility. Insulin resistance affects 50 to 70% of women with PCOS, increasing the likelihood of gestational diabetes if and when a woman conceives. Menstrual disturbances commonly observed in PCOS include oligomenorrhea, amenorrhea, and prolonged erratic menstrual bleeding. The next one is endometriosis, which affects more than 10% of women, causing significant pain and discomfort. It's an estrogen-dominant condition and an immune disorder where parts of the uterine lining are found outside the uterine cavity. Endometriosis is more likely to occur in women who have a sibling or parent with endometriosis. It occurs almost exclusively in women in their reproductive years, and it's associated with dysmenorrhea and menorrhagia, which we spoke about in episode 1 on menstrual health. It can be painfully debilitating. It can cause abnormally heavy periods, which may also involve large clots. Apart from the severe pain, the other major problem associated with endometriosis is infertility.
Number 3 is fibroids. Uterine fibroids are non-cancerous growths of the uterus. It is suggested that 1 in 4 women of reproductive age may have fibroids. However, not all those affected know that they're asymptomatic. I actually found out at 36 weeks pregnant with my first that I had 2 little fibroids hanging out there, and I had no idea. However, some of the signs and symptoms that show you may have fibroids are pressure and discomfort around the abdomen, pain during sexual intercourse, frequent urination, a heavy period, spotting between periods, pregnancy loss, and infertility. It has been suggested that submucosal fibroids may prevent implantation or the growth of an embryo.
Now, number 4 of our big 5 is thyroid dysfunction. The link between infertility and an underactive thyroid has been proven. Suboptimal thyroid function may be that missing link, especially for those with no specific reproductive problems. Now, the prevalence of hypothyroidism is 2 to 4% in women of reproductive age. Number 4 of our big 5 is thyroid dysfunction. Now, the link between infertility and an underactive thyroid has well and truly been proven. Suboptimal thyroid function may be that missing link, especially for those that don't have any other specific reproductive problems. We're going to be talking way more about thyroid function in episode 5. Now, the prevalence of hypothyroidism is around 2 to 4% of women within that reproductive age group. Hypothyroidism can affect your fertility for a number of reasons. It can cause anovulatory cycles, meaning that no egg is released, obviously making it impossible to conceive. It can cause high prolactin levels, which stops you ovulating, causes a sex hormone imbalance, and luteal phase defects, which may affect the time in which a fertilized egg has to properly implant into the uterine wall. There is also a link between low thyroid hormone and low progesterone levels. With low thyroid hormone, higher than normal estrogen levels are often seen, as high estrogen is known to suppress your thyroid hormone. High estrogen means lower than normal progesterone levels, and with this comes a cascade of issues relating to infertility, starting with anovulation.
And the last of our big 5 regarding infertility is the gene mutation MTHFR. The MTHFR gene defects contributes to elevated homocysteine levels. Elevated homocysteine is a risk factor contributing to recurrent pregnancy loss, preeclampsia, infertility, Down syndrome, and many other concerns surrounding pregnancy.
Now, please don't be frightened or concerned about the information that we've shared with you today. All the signs and symptoms that we have spoken about can be tested for, and they can absolutely be treated. If you feel that one of these may relate to you, then please contact a qualified healthcare practitioner such as your naturopath, nutritionist, or GP that specialises in fertility, and ask them about some further investigation.
That's super important. Yeah.